Nice to see you all, and Belisa, and where's Miguel gone? Miguel, thank you so much for hosting us this morning. Thank you for the extraordinary work that you do at Ser Familia to serve the Latino community here in Georgia. It's a pleasure to be with you.
Thank you, Senator.
Deborah, thank you so much for the work that you and your team at AARP do for seniors here in Georgia and across the country. And Secretary Becerra, it is such a pleasure to welcome you to the state of Georgia. Thank you for joining us, and thank you for your tireless advocacy for Georgia's seniors and seniors across the country. This is a big day for seniors. A historic announcement about something that so many have fought for so long. It's been decades that seniors in Georgia and across the country have been ripped off and charged exorbitant prices for vital medicine, insulin. Millions of seniors across the country who depend upon insulin to survive. This is about life and death, but who have had to pay, in some cases, thousands of dollars per year out of pocket to access this life-sustaining and life-saving drug. Working with Secretary Becerra and President Biden, Senator Warnock and I passed legislation last year that caps the cost of insulin for seniors on Medicare at $35 per month. And we're here to announce, with Secretary Becerra joining us, that this law is now in effect. No senior in Georgia, no senior in America will have to pay more than $35 per month for insulin. I want to repeat that again because it's so significant and so important for so many seniors here in Georgia. No senior in Georgia, no senior in the United States will have to pay more than $35 per month for insulin. This is about life and death, and this is about the ability of seniors in America to sustain themselves, folks on fixed incomes, folks who already have so much that concerns them, whether they can afford groceries and rent, folks who are depending on Meals on Wheels for help with nutrition. This is a big deal, and I'm so pleased the Secretary is here to join all of us, Belisa, in making sure that seniors in Georgia are aware that because of this law that we passed last year, no senior in Georgia will have to pay more than $35 per month for insulin through Medicare. It's now my pleasure to welcome and thank the Secretary of Health and Human Services, Xavier Becerra.
First, Senator Ossoff, thank you very much for the invitation. Actually, I should say for the insistence on coming to visit here in the state of Georgia to discuss so many important issues, but certainly for the millions of seniors in America and the seniors in Georgia, the life-changing impact that the law that Senator Ossoff, Senator Warnock, and many of their colleagues were able to pass. Oftentimes we talk about the ifs and we talk about the possibilities in legislation. This is real. And to Belisa, Urbina, Ser Familia, to Miguel, all the team at Ser Familia who see this every day and how important it is, we thank you for helping people understand their new rights. Because there's still seniors in America who aren't sure what's going on. And it's not until they actually go to pay for their insulin that they realize, wait a minute, I don't have to pay more than $35 anymore. I had a woman in Texas who came to me and said that in January, when she was charged for her insulin, she felt guilty. And she went back to her pharmacist and said, I believe you undercharged me for my insulin. Because she was accustomed to paying about $117 a month. And when they said, no, that's the new price under the law, she was ecstatic because she's on fixed income. The benefits are real. In Georgia, The average senior in Georgia is likely to save something close to $500 this year in pocket, real money. And Senator, the other good thing about this new law, the Inflation Reduction Act, this new prescription drug law that the president pushed for, is it's not just on insulin. Every senior in America today, including here in Georgia, who gets that vaccine, whether it's for the flu, or whether it's for COVID, or whether it's the one I hear about all the time, which is shingles. Because about one of every 3 Americans is going to at some point catch shingles. And no one wants to catch shingles, let me tell you right now. It is painful. Some people were paying $100, $200 for that vaccine. Zero. This new prescription drug law means that seniors in America will no longer pay any money out of pocket for those vaccines that are preventative and prescribed by their doctors. That's real. When you add up the savings on the vaccine, no charge, with the savings on insulin, those seniors are probably going to save between $500 to $600 every year. That's the good news. The bad news is that they were paying $500 or $600 more than they needed to for every year before Senator Ossoff was successful in getting this law passed. But that's the difference we make. And guess what? The mojo's with us. The momentum is with the president and his efforts to lower prescription drug costs. And so it's not just seniors in America who will get insulin for about $35. Now it's pretty much everybody in America, because guess what? The manufacturers of insulin, the drug makers for insulin, there are about 3 or 4 major manufacturers, they've all agreed to lower their prices as well. And so that's the impact that Senator Ossoff, Senator Warnock, and members who in the Senate and House supported this have, and the efforts by the president to push this, that now it's not just those on Medicare, it is most Americans who today will get the benefits of paying less for their insulin. And guess what? The law doesn't end there, because we're now going to get to do the same thing, use that momentum when it comes to other drugs. Because in America, Americans pay about 2 or 3 times more for their prescription medication than people around the world for the same drugs. Sometimes drugs actually manufactured here in the U.S. That's not right. And this new law Senator Ossoff made possible is going to help us now negotiate. It lets us negotiate with those drug manufacturers to get the best price for Americans. That's the good news. That's the momentum. That's where we're heading. And we want to thank President Biden, Senator Ossoff, Senator Warnock, and all those members in the House and Senate who had not just the vision, but the courage to move forward and do something that had never been done before. Let us actually lower prices and provide real benefits now, not in the future, but now, to Americans who need that relief. So thank you, Senator Ossoff, for inviting. Thank you, Belisa, for letting us come to Ser Familia. Thanks to all the people who were here. We had several of the commissioners from Gwinnett County who were here as well. I want to thank them for the work that they're doing. Representative Marin was here as well. It's a team effort, and so I'm pleased to be here. But what's better is that we got good news to share with seniors in America and seniors here in Georgia. Thank you.
Thank you. And Jake will call on folks for your questions, please, if you can let us know who you want, correct, to ask.
Yeah, Mr. Secretary, I hope you don't mind if I go a little off topic here. But I'm wondering...
And Greg, let me ask you, Senator, do you want to stay on topic first and then take those that are off topic?
I can do an on-topic and an off-topic.
Why don't we take on topic first, and then when time permits, we'll go to the off topic. Okay.
On topic first, then, how are you going to encourage private pharmaceutical companies to expand beyond those who are recipients of Medicare to take steps? We've already seen some big companies take these steps.
Yeah.
How are you going to encourage them to work?
Well, and what the president did was something very simple. He pointed out to Americans what the real cost of insulin is. How much does a drug manufacturer actually pay? And he put it out there in his State of the Union. He said it costs about $9 or $10 to get that insulin on the shelf in the pharmacy or at your doctor's office. So why were people paying $200 for the drug? Of course, we know that's the case on a lot of drugs. And so what the president simply said is, now we should make the push to get insulin for everyone for $35 or less. We saw the success with insulin. I think you're going to see that with more drugs. But now we also have, by law, Senator Ossoff made possible for us to have, by law, the right to negotiate the prices on those drugs in the future.
Can I go off topic now?
Let's go just on topic, then we'll come back to you then. Is that okay?
Yes, with over half of Georgia's seniors being on Medicare Advantage, I was wondering if you could talk a little bit about the changes coming down the pike on Medicare Advantage, and also what changes do you still think need to be made in order to protect those seniors?
Yeah, and Senator, if it's okay, let's take that one. Let's handle that because it's a little off topic, but we'll get to both of those before we cut. Any on the subject of the new prescription drug law?
I have one. Do we have an estimate of how many Georgians this will impact? I knew you would.
So I'm basing it on real numbers, so I'm going to take you to 2020. In the year 2020, there were 45,625 Georgians, not 45,626, not 45,624, 45,625 Georgians who were enrolled in the prescription drug benefit program within the Medicare program, Part D. Had this law been in effect in 2020, on average, that means some would have saved more, some a little less, on average, those Georgians would have saved $477 just on their insulin. If you want to talk about the savings on vaccines, 93,651 Georgians received vaccines under that Medicare Part D program in 2021. They would have saved on average, some more, some less, $74 on those vaccines. Real money, because no one's going to stop getting that shingles vaccine. No one's going to stop getting their insulin. It's real money.
What is some of the pushback you're getting from the pharmaceutical companies that are saying that this is stymieing their research and development?
Let me let Senator Ossoff.
Thank you for the question, and this is an important point to make. In passing this legislation to help seniors afford medicine, to cap the cost of insulin at $35 a month, there was fierce opposition from drug companies who are accustomed to making a lot of money forcing seniors who need insulin to survive to pay thousands of dollars a year for a medicine that, as the Secretary said, costs just a few dollars to get to the shelf. We stood up to the pharmaceutical industry in passing this law to save seniors in Georgia hundreds of dollars per year and help them afford life-saving medicine.
All right, we have time for about one or two more.
And we'll make sure we go to the off-topics questions.
Any
soon.
last question? One last question, and then we can go to Bluestein. All right.
Secretary, are there any steps that you or the administration, but you can get two senators if you want. If there are any steps that you or the administration is willing to take after the federal judge's ruling involving
Mifepristone. We're going to be vigorous in defending the Food and Drug Administration's approval process. We don't believe it is in anyone's interest to have the sound, tested, proven approval process that FDA goes through before it lets any drug on the market be overturned, turned upside down. Because it's not just mifepristone which is put at risk. It's the insulin we just talked about. It's the vaccines that we just talked about. All of those different medicines that today Americans feel safe and comfortable buying, because they didn't go out, they weren't in their kitchen making that drug. They're buying it off the shelf. They have to depend that that drug is going to be safe and effective. That's FDA's charge, to make sure that no drug is on the market unless it is safe and effective. That's what they did with mifepristone more than 20 years ago. And then to have one judge in one court in one state say, for everyone in America, no, that's extreme. And so we're going to defend this through the legal process every step of the way. We believe, we're very confident that we will prevail because it's not just access to mifepristone, which millions of Americans have used over those 20 years, which is made available in more than 60 countries worldwide. It's because we want to protect mifepristone, we want to protect insulin, we want to protect all those life-saving drugs that Americans rely on because they are safe and effective, because FDA went through a process to make sure they were. Senator.
All right, one more.
Medicare Advantage question.
And then we'll go here.
Ah, well, okay.
Oh.
All right, quick.
You got a hard
Medicare Advantage. Medicare.
What changes are coming down the pike? To be clear, does the insulin cap apply to those folks on Medicare Advantage? And what other changes do you think are needed in the MA?
Anyone in the Medicare program, 65 million Americans, if you need insulin, you should not be paying more than $35. And by the way, if you are, you're entitled to your money back that you paid over $35. And if you can't figure out who to call, 1-800-Medicare. Give us a ring, and we'll help you. Because no one should be paying more than $35 anymore. Save that money for other important things, or some kind of gift or something fun for your grandchild. You know, that's your money, and you shouldn't lose it. On Medicare Advantage, by the way, Medicare Advantage is the managed care program within Medicare, as opposed to the traditional Medicare program. Either way, they're all Medicare. And it's incumbent upon us to make sure that every dollar that you've paid in through your paychecks into the Medicare program goes to help you get your benefits once you qualify for Medicare. The changes we've made to the managed care program in Medicare are to bring back dollars that we overpaid, that we were overbilled. There are billions of dollars that we were overbilled, that you were overbilled. Taxpayers and Medicare recipients were overbilled. We've proposed changes that now make it possible for us to go in, do the oversight, and if we were overbilled, get that money back. We're also making changes to the program to make it more precise on how they bill those insurance companies bill the Medicare program. And so at the end of the day, while we increase the actual amount that we're providing for the Medicare Advantage insurance companies to provide services, we're actually restoring money to the Medicare program.
I think there was one more right here. Yeah, go ahead. We'll,
Mr. Becerra,
okay.
Two, I think.
Mr. Becerra, this is regarding the divorce bill. Should the Biden administration ignore the court's ruling on the FDA, even if the court sides with upholding the approval?
Well, the administration, the president and his administration made very clear, we have a very strong case because the FDA has followed all the rules and used the evidence to make a decision. We feel very confident that ultimately we will prevail in court, that this one judge in one court in one state should not have the ability to undermine safe and effective medicines that millions of Americans rely on. And so through the legal process, we think we're going to make our case very strongly.
All right, we're going to close with Richard, and then the secretary's got to get to his event.
It's a two-part question, but it is, what is our posture right now? Because we have two competing federal court judges making competing rulings, so where are we right now? Is there a hold or is there not?
So,
I have a follow-up.
yeah. So let's be clear, and I say this for every woman in America who may need mifepristone. Mifepristone is still legal for use. Mifepristone is still available today. And we are going to do everything we can within the legal process to ensure that that doesn't change. But I don't want anyone to hear or see the news and wonder if they can still have access to mifepristone. Right now, the judge himself stayed, he put a hold on his own decision. And even if the judge's hold were to expire, we're going to court to appeal the decision, also to try to put on hold that judge's decision until an appellate court or a higher court can make a decision. And so, one way or the other, the president's made the commitment. We're going to use every available resource to protect a woman's right to reproductive health care.
Just really
Senator.
quick. That's it.
Richard,
All right, we gotta go. We gotta go.
The secretary's got to go. Richard,
gotta
you
go.
had one other thing.
One lawmaker I spoke with today lot of this would be cleared up. Congress could kind of put an umbrella rule, law. Obviously, that's going to be very difficult with the way Congress is set up right now. What are y'all doing to try and, for lack of a better phrase, clean up all the patchwork of abortion laws that are across the United States?
In terms of these two district court rulings, I expect this to play out through the legal process, through the courts, and from the perspective of the Congress, my view, as you know, Richard, is that these decisions are best made between women and their doctors without the interference of politicians. Right now we're seeing in Texas what happens when politicians decide that they want to intervene in those deeply personal healthcare decisions. So we're going to have to wrap this. I just want to make sure that everyone understands very clearly what we were here to discuss and what we want seniors in Georgia to understand, which is that now it is the law that no senior in Georgia and no senior in the United States can be charged more than $35 per month for insulin through Medicare. I want to thank the Sheriff's Office and the Sheriff's deputies for your service and taking care of us today, and all of you for keeping the public informed. Thank you so much.